Good morning, everyone. We've had a couple slight little technical difficulties here this morning, but I think we're all squared away. Everybody should be able to see our opening slide here. My name is Jay Kempton, and I'm the administrator of Advantage Health Plans Trust, and this is my trustee expert sidekick, Maria Robles Meyers. We're going to be here with you all today talking about the fines, fees, full-time, and deadlines, and how to avoid a compliance nightmare within the Affordable Care Act. Some of the things that we're going to be doing today are walking through some of those really hands-on, actionable things that you all as Advantage Health Plans members need to be thinking about, need to be aware of as we step through the Affordable Care Act. We've all probably been to webinars at this point, had seminars. We've gotten probably more emails than we could even care to admit to about the Affordable Care Act. But if you all are like us, most of the information that you get and the webinars that you may have attended have been very general in nature. They'll kind of tell you, I call it a lot of shock and awe. A lot of things that are scary, which some of them truly are scary, but has not been a lot of, okay, so at my bank, what do I need to be doing? And so that's what we're trying to do today in this webinar, is really get the Affordable Care Act in the context of a community bank in Advantage Health Plans. And so that's what we'll be focusing on today. We do have almost 100 registrants for this webinar, so this is one of the biggest ones that we've ever done. We're really happy about that. Thank you all very much. And we also are aware that we do have a few non-Advantage Health Plans employers that are on the call, which we welcome you wholeheartedly. But please be aware that when we talk about some of the things that we're going to talk about today, they are going to be in the context of Advantage Health Plans being a self-funded multiple employer plan. So with all that being said, I'm going to go over the introduction here real quick. Some of the things that we're going to be doing is looking towards 2014, the pay or play tax, which I know that's probably, if you all are familiar with kind of what's going on, that's one of the things that we've been getting the most questions here at the Kempton Group about. What is a full-time employee and why does it matter? It matters more now than it ever does, and Marie's going to go through the methodology of determining that. Who's the employer? And then the ACA fees. Of course, those are not to be confused with taxes. Also exchanges and how they may affect you and your employees, and then also what you should be doing now. So at this point, I'm going to go, and we are going to, this is being recorded, and so you will have access to the full video and the PowerPoint slides in usually a couple of days after the webinar. They'll be available at advantagehealthplans.com, and we'll be emailing copies and links to the slides to anybody that's registered. So questions, yeah, thank you. Questions, we are going to have a question and answer time at the end of the presentation. And we are going to be here really as long as we continue to have questions. We do anticipate there'll be some. And as always, if you have a question of a more particular nature or something that maybe is has a little bit of a privacy concern, you can sure email us or give us a call, and we'll reach out to you and we can have a private conversation. So with all that being said, I'm going to turn this one over to Maria, and I'll be back at the end to take some questions. But Maria, take it from here.
Good morning. As we look towards 2014, I just wanted to share with you, I was driving into the office this morning listening to a presentation, and they were commenting on comments made by Senator Baucus, who is probably the most outspoken proponent of Obamacare, and Senator Rockefeller, equally a strong proponent. And both of them described the 2014 as a train wreck. And I thought that's pretty accurate. What I'm going to talk about today is fairly complicated. I'm going to try to simplify it as much as I can. Some of it will not answer all of your questions, so jot them down so we can identify the specific questions that you have. But bear in mind that as we go into the implementation stage of Obamacare, even though it is technically effective January 1, 2014, there are still many regulations to come. with many, many factors to be outlined and explained in more detail than what we have today. It is still evolving, and all of the answers are not yet known. So keep that in mind. So with that in mind, the changes that are on the horizon, 2014 is expected to be just an incredibly big, busy year because Obamacare is finally rolling out to the stage where it is actually going to be implementing some kind of health coverage for individuals. What is important is that you understand your role as an employer and what you need to be doing and what you will be responsible for, and understand what Advantage Health Plans Trust is doing for you as an employer, because we are working very diligently at defining and modernizing the plans to fit the requirements that you will have to comply with so that you can be compliant in all of the regards. As the changes are taking place, it will be your responsibility to ensure that all of them are communicated to your employees so that they understand what's happening. And as we walk through the presentations, you'll notice that there are some dates that are going to be in here, and it's important that you understand what they are. And then finally, questions will be there, and we are anticipating more questions rather than less questions. So if you need assistance, if you have questions, don't hesitate to send them in. Not just on this presentation, but send them in to Advantage Health Plans Trust, because we will be able to assist you with any issues that come up. Some of them will be specific to you, some will be more general. The purpose of this seminar originally came about because we kept hearing from employers with some of the same generic questions, and we thought, it's time to kind of get out here and give you some more information to help you deal with them and help you understand what your responsibilities are. So with that being said, I want to move to the big part of it. Most employers are worried about the pay or play taxes. Some people call them fines. I don't think they're fines, they're taxes if you're required to pay something that is a tax. So there's really a couple of areas in a big mode capsule that I want to kind of talk about. The first thing is, and this is very critical to many of you bankers out there, who do the taxes apply to? And I want to make sure that everybody is clear that the most important thing you can take with you is that it applies to employers that have 50 or more full-time employees or full-time employee equivalents. You aggregate those numbers. And if you are in that category, these pay or play taxes do apply. If you are below that 50 employee mark, the pay or play taxes do not apply to you. So keep that in mind as you're working through this presentation and understand how you're going to decide whether you are or aren't one of those employers that fits that category, so that you understand how it will work. The second part of what I want to talk about is exactly how does it work. There's a lot of confusion with the $3,000 per employee, $2,000 per employee, and I want to just kind of give you a sense of how those two provisions work, how they interact, and when they would apply to you. And those are generally they're the sledgehammer penalty or the tack hammer penalty. And you'll hear a lot of titles given to this tax. The pay or play is pretty common. The sledgehammer, tack hammer penalty is also being used quite a bit. So when the people are talking about it, they really are talking about the same thing. To me, the very first question that needs to be addressed is, who is the employer? And this is probably the area that is raising the most concern to employers right now, because there's so much confusion as to who the employer is. Now, the rules that apply for purposes of the health plan are the same rules that apply to any of the employee benefit plans and the retirement plan. So what I want you to focus on is identifying who the employer is for purposes of these taxes. That does not change in any way, shape, or form the legal structure of the entities. It can be something where you have multiple employers, and I'm going to tell you that today, in most circumstances, given we're going to talk a little bit about the control groups here, but these multiple entities will be treated as if they are a single employer. It does not eliminate the legal status of your entity. So if you have two or more entities that are treated as if they were a single employer, for state law purposes, they are still two legal entities. But for the employee, for the taxes that apply to the employer, those two entities are treated as if they were a single employer. So kind of keep that in mind as we work through this. The reason that that is important is that when you're determining whether or not you meet that 50 or more count, you have to include all of the entities that are under common ownership or control. For those of you that have retirement plans, you may have already done the analysis. It's known as the 414 BC rules, as the control group rules. They have been around a very, very long time. They are complicated to apply, mostly because they're very fact specific. But essentially what you have to keep in mind is, if you've already done the control group analysis for your retirement plan and you have multiple entities that are treated as a single employer for purposes of your retirement plan, the odds are extraordinarily high that you will also be a single employer for this pay or play penalty tax that will apply to you under the Obamacare provisions. The basic premise is that if you have employers that are under the same ownership or control, they're really treated as a single employer. The rules were initiated many, many years ago, basically to avoid the abusive schemes that were being set out in the early 80s, where employers were trying to create separate legal entities to put employees that were the ones that were favored for benefits in one and the ones that they didn't want to provide benefits for in the other. And so as a consequence of those structures, what came about is this very complicated set of rules that basically require you to aggregate all of those entities and treat all of the employees as if they are employed by a single employer when you're applying non-discrimination rules. The basic premise is if you have two entities that have an 80% or more common ownership, they are treated as a single employer. It's really easy to apply when you're dealing with corporations because you've got stock ownership out there. So for those banks that are out there that may have 2 or 3 separate entities where they house individual bank locations and a holding company, and the holding company is the sole shareholder of the subsidiary below it for the local bank, that is going to be a control group. The 80% test is going to be met anytime you are a wholly owned subsidiary. So it doesn't help you to try to shift employees from one bank location to another if they are separate legal entities, because they will be treated as a single entity. The one that is a little more complicated to apply is when you're dealing with entities that don't have stock ownership, and there you're dealing with partnerships, limited liability companies where there are members. Those are a little bit more difficult because you've got to actually look at where the interest lies, and generally it's a profits interest that you're looking at. So these rules are not very easy to apply, but they have been around a long time and they have been fairly tested, and they are applicable once you figure out how to do them. It is a difficult thing to tell you here at this seminar how you apply it in your own specific situation because they are very fact-based analysis. If you find that you have not done an analysis through the retirement plans that you may offer, and you are concerned that you have more than one entity that may fall into this control group rule to determine who your employer is, then it's important to get into that analysis now and determine whether or not you are a control group. If you are a control group, you're over the 50, the pay or play penalties that I'm going to talk about will apply. If you're not part of a control group and each of those entities is looked upon as a separate employer because you do not aggregate them, then the 50 or more will apply to each entity as opposed to the entire group. So that's pretty interesting, and it's very detailed oriented, very difficult to apply, and certainly not something that I could give you a presentation on today to help you out in terms of applying it on your own. I will tell you again, if you've done it for your retirement plans, go take a look at your retirement plans. You will find provisions in your agreements that talk about related employers or employers under common control, or you'll see them under 414 BCM employers. Any of those categories are going to define the entities that you have listed as being part of the group. If you've met that criteria in the retirement plan, you will have met it probably for this one as well, unless something has changed. Otherwise, you need to sit still and look at the control group analysis for your particular entity and start identifying whether you are or aren't. And the easiest way to start that is to draw a graph of all of your companies and outline ownership from one to the other so you can determine whether or not it is there. If you're going to need assistance with that, I'd suggest that you contact either your legal counsel or your accountants. Either or both of those should be able to help you. And if you really get stuck and you can't do it, call me. That being said, if you are an employer that has the 50 or more employees, either because the entity in and of itself meets the 50 employee test, or because you've aggregated a group of entities and in the aggregate you meet the 50 or more, then you are going to be subject to the pay or play penalties. If you are the employer and you're sitting there going, nope, I don't have 50 or more, no, there are no other entities involved, the penalty discussion that I'm going to present to you should be rather informative, but it will not be an applicable tax that applies to your entity. So once you know that you are an employer subject to the rules, then the next thing that you've got to determine is, who are these full-time employees? And essentially what you have to do is, when you're looking at this rule, the penalties apply when you have the 50 or more, when you're an employer that has the 50 or more full-time employees or full-time equivalents. And then you have to determine who these full-time employees are, because those are the people that are going to be the ones that are going to be offered coverage. Now, full-time employee from the federal point of view is a 30 or more per hour average weekly work schedule. So if you have employees that you know are regularly scheduled to work 30 hours or more each week, those individuals are full-time employees. And when you're doing your count to get to the 50, that counts as one. It doesn't matter whether they work 60 hours a week or whether they work 32 hours a week, they count as one. The second component in getting to the 50 number is in determining who these, what the code calls full-time equivalents are. Because the 50 or more employee rule is not strictly applied by adding only the full-time employees. It is full-time employees plus full-time equivalents. Now, for purposes of what we're talking about, the 50 employees, real full-time employees, let me go back. The real full-time employees plus the full-time employee equivalents, when combined, if that number is 50 or more, you will be an employer that is subject to the pay or pay penalties. And the question has come up rather frequently as to how you identify these full-time equivalents. In a simple mode, if you have two part-time people, two clerks who each work 20 hours a week, you would add up the 20 hours plus the 20 hours, and you basically are going to end up with 40 hours, which is short of 30. And believe it or not, the IRS says you round down. So you have one additional number to add. So you don't add two bodies for the two part-time people. You add one full-time equivalent to the number of real full-time people, and that's how you're going to calculate the number that you have in terms of whether you're at the 50 or more category. I know I've had people talk to me and say, well, I'll just drop everybody down. And you can drop hours on people when you're looking at this 30 hours to say, well, they're not full-time anymore, so they don't count. They could still count in the full-time equivalent analysis to determine whether or not you're under the rule of the 50 or more employees for purposes of fitting into this pay or play penalty. But they are not people that you necessarily offer coverage to. So keep in mind, when I'm talking through this full-time equivalent, we're talking strictly about identifying who these individuals are, how many body counts you end up with on an equivalency basis, solely to determine whether or not you're going to be over the 50 or more category. So if your bank has 25 full-time employees and you have 3 part-time employees, you're never going to get there. But if you have 40 full-time employees and you have part-time employees, that's where you're likely to take a look at the numbers, because you may cross over to the 50 line when you aggregate the equivalencies of these part-time people. Okay? And again, I'm going to emphasize that strictly for purposes of calculating whether or not you have met the 50 employee threshold. That's the sole purpose of doing this calculation. When you add your full-time employees with the full-time equivalent, are you over the 50 mark? If the answer is yes, you're under the tax. If the answer is no, you're not subject to the pay or penalty tax. The part-time people in the banking industry, you generally tend to hire tellers who are part-time people. Those are kind of easy because they're people that are regularly scheduled to work a set number of hours, not necessarily the 30 or 32 level, somewhere below that. But you have a criteria where they are set to be on a regular basis, and those are easy people to work with. They're easy to quantify their numbers and extend them out and decide how many full-time equivalents you get from those people. The ones that are giving people a headache right now are these variable or seasonal employees and how to include them. For the most part, the banking industry really doesn't have variable or seasonal employees in the way that other industries have. You know, the seasonal employee category comes into play like in the retail industry, where they hire people at Christmas time and they staff the stores for Christmas sales. And those truly are seasonal individuals. They are hired for the Christmas sale. They come on just before it starts and they go off just after it ends. Those are not normally in the banking industry, but those are the ones that really are generating some concern for other people. The other ones are the variable people. And those are even more difficult because those are people that you hire and you don't know whether you're expecting them to be full-time or part-time. You are not positive. It could be someone that you hire to kind of test out and determine what position you might put them in. Not a normal thing that you would see in the banking industry, but it is possible that you may have someone where you hire them and you're not positive that you're going to really put them on a part-time basis, like at the teller level. You're hiring them with the expectation that you're going to be moving them into different positions, but you're just not sure of how to do it. The interesting thing about those is that there is I have to get organized here for a minute. There are some rules that are going to apply, and I think I'll show you my little pretty picture in a few minutes here. There are some rules that the IRS has put out that are intended to help you. I've been reading regulations a long time, and some of these rules are very difficult for me to understand. And as I'm reading them, I'm going, how on earth do they anticipate an employer can read this and understand how it works? But for your purposes at this point, understand that what your job is to look at your employee census, determine who the true full-time employees are, determine whether you have non-full-time employees, and then determine whether you have seasonal or variable employees. And once you identify each person within each category, then you do the actual calculation. Full-time employees count as one. The full-time equivalents are based on aggregating the hours for all of them and dividing them by the number of, if you're doing it on a monthly basis, you divide by 130 hours, and then you round down to come to a body count to add to your actual full-times, strictly to determine whether or not you're at the 50 threshold level. That's the only purpose of this discussion. So it's, be very clear. There's a lot of confusion on this, but that is the sole purpose of that discussion. Pay or play. Let's assume you have met the 50 threshold. So now you know that you are an employer that is subject to the pay or pay penalties. And the question then becomes what's it going to cost me? There are two levels. The first one is generally called the sledgehammer. And that's the one where you offer no coverage. You choose to just offer nothing to your employees. Or you offer coverage that is not sufficient to meet what the IRS determines is a minimum level of coverage, or it's not affordable to all of your employees, and you're treated as if you offered no coverage at all. If you're in that category, the tax that applies to you is a $2,000 annual total amount, but it is determined on a monthly basis, and it is determined for all of the employees that are full-time employees minus one. But that middle section tells you there's an and category. It's not just that you don't offer coverage, it's that you don't offer coverage and they go on to the exchange in your state and they get a subsidy. They get government premium assistance and they get a subsidy. Now, if you have a person who goes on the exchange, they don't qualify for a subsidy, it doesn't impact you because you have to have at least one of your full-time employees actually on the exchange receiving a subsidy before you would then ever calculate any of the penalties. So to kind of recap, the sledgehammer, which is the portion where you offer no coverage or you offer coverage that is not sufficient to meet the minimum, and you have one of your full-time employees that actually goes on the exchange and that person gets qualified for a premium subsidy, then you will have a penalty. The penalty is determined from an IRS point of view based on a month-to-month basis. So if that occurred for 12 months of the year, the $2,000 for the full-time employee might be applicable. If it occurred for 3 months of the year, it would be the $2,000 divided by the 12 times the number of months that you actually didn't have it. So the reason I'm saying this to you is I think most employers are not going to be in this particular category. Most of the employers that I'm talking to you out there, those of you out there today, are not going to be in the sledgehammer penalty because most of you will actually be offering coverage. You're not going to be in the category where you don't offer coverage. It is important to note that if you are subject to it and you choose to pay the tax because you don't offer the coverage, that tax that you pay is not deductible. So you're talking about a maximum $2,000 per full-time employee after you net out the first 30. And that amount of money is not going to be a deductible item on the profit and loss statement. So to pay the $2,000, you really got to gross up the cost of that for the taxes that you're paying to determine what it really costs you. It's not really a $2,000 penalty. It's $2,000 plus the taxes that you are now going to pay on the $2,000. So you have to gross it up to come to the real cost. But it is not a deductible tax. The second component of the pay or play, which is where more employers are likely to be, is what they call the Tack Hammer. And it is generally viewed as being the lesser of the two, if you would. And this one is if you offer coverage, and you offer coverage that has the minimums, and you're offering your coverage to the full-time, but it's not affordable to a full-time person. It's too expensive, and we're going to talk about what affordability is in a little bit here. But it's not affordable, and that person goes on the exchange and qualifies for a subsidy. Then you're exposed to a tax. Now the tax on this one is the $3,000 per person, and these are only the people that actually are on the exchange receiving the coverage. The prior one is on all of your employees minus 20. Okay? This one only applies to the employees that actually go on the exchange, and it's based on the $3,000 for that one person only. So you see where the sledgehammer, tack hammer kind of come into play. The sledgehammer is if you don't do it at all, you're going to take all of your full-time employees minus the first 30, and you're going to pay a penalty on all of them. If you do offer the coverage, but you still have one that goes on to the exchange, then the tack hammer penalty will kick in, and that's going to be the $3,000, but only on the ones that go on the exchange that got coverage, got a subsidy, and it wasn't affordable. So whereas in the sledgehammer, you're exposed to all of your full-time employee base minus the 30, in the tack hammer, the penalty exposure is only on the particular individuals who don't have the coverage under your plan, but went on the exchange. And both of these are critically associated with the fact that that individual has to go on the exchange and get a subsidy on the exchange. And if you've been reading the news, you've seen the stuff that's been coming out. The application to log on to the exchange is out. It's an 18-page application for people to qualify. And there's a tremendous amount of financial information that has to be provided in order for them to be able to identify the financial need. One of the things that's interesting is that when we're looking at the $3,000 or the $2,000 and the affordability under your group, you're going to be measuring affordability based on an employee, one employee only. When you're measuring it on the exchange actually measures affordability based on households. So even though we've got two measurement sticks, you're bound only by the measurement of your part of it, which is the employee only. And it is possible that you have an employee that gets coverage through your plan. It is affordable under your plan. They go on the exchange, and suddenly they get a subsidy because the household income qualifies them. That doesn't impact you because you're offering the coverage that meets the minimums, and you're offering them what you have under your standards, and therefore you don't necessarily get impacted. So there's kind of this bifurcated methodology for determining who's going to get credit and subsidies on the exchange and when it's going to be a taxable event to the employer because they are on the exchange. Again, the tack hammer penalties are not deductible. It is a non-tax deductible item at the employer. I'm still trying to figure out how you're going to know when you got to pay it. I'm not convinced that I know exactly how that's supposed to work. Let me move to the next one. This changes a little bit in terms of what I'm going to say to you, and I want to make sure that everybody understands the distinction. The first two, we were talking about whether you are under the umbrella of being subject to the tax based on full-time employees and full-time equivalent. This we're going to talk about who you offer coverage to. Penalties do not require that you offer coverage to every employee. It requires that you offer coverage that is available to full-time employees. So when I talked about full-time equivalents before, in terms of determining whether you're going to meet the 50 threshold or more, this is not the same thing here. Now we're talking about true people who are entitled to to receive the coverage. Those are a little bit separate, so keep that in mind. Full-time employees, 30 or more, you know they're regularly scheduled to work 30 or more hours, you must always offer coverage. unless you're going to choose to not offer any coverage at all, which I don't suggest that you do. So if you have full-time employees, 30 or more, offer coverage. Part-time employees, those tellers that we talked about that are making the 20 hours, 25 hours a week, they are not required to be offered coverage. The only tricky part is if the employee is working less than the 30 hours, you're not required to offer coverage, but you should be monitoring them to determine that they don't suddenly shift into that category that is the 30 or more. So part-time employees, under 30 hours, you don't offer coverage. A lot of the employers I'm speaking to right now are really being pretty adamant that they are monitoring part-time status, and they are going to watch those hours like a hawk and not allow employees to come over the threshold where they have an average of 30 or more hours. So they are literally cutting employees off, saying you're scheduled 25 and that's it. We're not allowing you to go anything beyond that. I think in the true world that sometimes is difficult to apply, especially in the banking where you're trying to get someone to cover for someone who is off. It's easy to put on another part-time person to fill in the spots of someone that's already missing, and therefore suddenly you've got someone on maternity leave, and during these 2 months, this part-time person who was regularly scheduled to work 25 hours is suddenly working 35 hours. Those are the ones you really have to monitor. And it's not the end of the world if you have to offer them coverage. You just have to watch and make sure that you know who they are and if they switch those categories, because if they do and you don't offer coverage, then you flunked the first part of the test because you didn't offer them coverage. The other people, those who could become full-time and those that could be deemed full-time. And this is where the ones where truly they're not set in stone. Employees, for purposes of all of this analysis, are common law employees. And common law employees has always been kind of an interesting, crazy thing out there. Because the IRS has its view as to what is a common law employee, and sometimes in real life people have a different notion. So let me just tell you a couple of things here. Independent contractors, those are people that get 1099s, not W-2s. They are not your employees. The only thing you need to be careful of is if you have people that really are your employees because you do supervise them, they are under your control, you set the schedules, you meet all of the stuff that's supposed to be there for employee status, but you say that they're an independent contractor. If you call them an independent contractor and they're an employee, they are an employee. So watch for those that really are independent contractors on your system, but really they're not. They really are employees. You're just choosing to classify them in the wrong way at this point. Those are important. The other part are these people that you get like from staffing agencies that come on board, or employees that you may have through a PEO. That's one area where it's kind of being interesting right now because the IRS thinks that every person can have one employer. PEOs function under the concept that's a professional employee organization, staffing companies, if you would. They function under the mode that they have two employers. They have the employer that is the PEO that they are hired through, and they have the employer that is the bank where the employee actually does the work. In the retirement plan arena, the IRS has taken the view that they are the employees of the bank, not the employees of the PEO. There's still a lot going on in this area, but if you have employees that are part of a leasing arrangement or you go through a professional employee organization, whatever title they're using, be sensitive to the fact that you might still be the employer, probably are going to be the employer, and the penalties are going to apply to you, not to the PEO, but to you. There's still something that needs to come down from the IRS on this agenda in terms of identifying it. They have been very clear in the retirement plan arena, and if you're in PEOs, you already know how the retirement plans work for PEOs. I think the answer is going to be the same in the health plan. The variable, seasonal, I'm not anticipating that banks are really going to have a lot of these seasonal people. It is possible that you have the variable people. Those are likely to be interns, people that come in and they're working on and off during school seasons. Watch their hours. My preference on all of this is to say keep them below the 30. Keep them below the 30. This is my favorite part. When you look at these employees, you know the 30 hours. Those are easy. Those are simple to kind of work because most of you have already identified them as full-time employees anyway. But when you're monitoring these other ones that are not at 30 hours, there's two ways to do it. My preference is what I call the monthly monitoring system. And here's the short version. Let's see if you can zone in on this. And that is, if they're 30 hours or more, you offer coverage. If they're not, you monitor the employee and you watch them month to month until you get to the point that you're seeing that they start to average 130 hours a month or 30 hours a week. And if you start to see that, then you need to look at them because they're probably going to be a full-time employee. Now, the IRS has a simplified method, they think. They call it a safe harbor. And their safe harbor, and I've read through this, and it's very, very confusing. Their safe harbor looks more like this. And you've probably seen some of this, or you've seen the talk about this, where they're talking about having a measurement period and a look back period, and you're going to look back, and then you're going to have a time period where you're going to analyze these employees, and then you're going to have define a measurement period when you're doing this analysis, and then you have an administrative period to give them time to get enrolled, and then you have a stability period during which they have to be covered. This is designed to favor employees. It is not designed for an employer to do on a real life basis. I'm showing it to you just so you can see it is a really complicated way to apply the rule, and it's applied on an employee by employee basis. The time periods, of course, are set for everybody, but it's the employee by employee analysis. As I went through these regulations trying to define how would you ever do this in real life, I came to the conclusion that you don't want to do it. If you're looking at the classification of employees that are not the full-time employees, and you're looking at it from the point of view of trying to decide whether or not they ought to be full-time because of the hours that they work by measuring them through these measurement periods and stability periods, I'm telling you it is going to be a very difficult task because you will have measurement periods that will span from the original hire date to the regular plan year date, and you're going to have people coming and going. The main thing that I think struck me when I analyzed the rules, and it was pretty much confirmed when we were in Washington, D.C. last week or 2 weeks ago, was that the rules are designed to favor the employee, so that if you have a person who is not deemed to be full-time and they're in this stability period where you're waiting and they suddenly do turn into full-time, you better add them on. The rule is you've got to give them coverage. As soon as you know that they're the 30 or more, they come on. But if it goes the reverse and you have someone that became more than 30 and you put them on and you gave them coverage and now they're back because they're not doing the maternity coverage anymore, they're back to their regular 20 hours a week, you have to continue to treat them as if they were full-time employees until the end of the stability period, and you cannot terminate their coverage during that time period, and you cannot offer COBRA coverage during that time period. So you end up with this bifurcation of employees that really are not full-time employees but are deemed to be full-time employees even though the hours say they're not, because you gave them a stability period. And so the more I looked at it, the more I'm walking away from it going, stay away from the safe harbor. It is not safe at all. That's my 2 cents on that. Now,
The unsafe harbor.
it's an unsafe harbor. It really is very convoluted and very difficult to apply, and it's unless you have a real need to do that, I would encourage you not to do it. Most employers that I'm talking to, even the larger employers, are just saying you're either part-time or you're full-time, but we're not going to have any of this stuff where you're moving in and out of categories, because it really is a trap. You're likely to find yourself in a situation where someone crossed over the line and you didn't offer them coverage, and now you are subject to a penalty because you didn't offer that person the coverage that they were entitled to. That probably is going to be the area that's going to generate some questions from you. If I were to give you advice at this point, I would say go take a look at your employee data, your census, identify everybody who is full-time and classify them as full-time. Titles don't matter. It's a 30-hour or more. But look at everybody that doesn't meet the 30 or more hour requirement right now, and look at them and ask yourself whether they are people that you need to keep at the less than 30 hours, and if so, you need to monitor those hours and not allow them to get above it. If there are people that will go up and down, you might want to just consider readdressing their classification, switching them over to a full-time status, and moving them into the next classification. And that's going to simplify your life and make it less likely that you're going to make mistakes. The second area that I'm going to talk about, and I call these things taxes because a tax is a tax is a tax. If you got to pay it to the IRS, to me it's a tax. I don't care if they call it a penalty or a fee, it's a tax. And there's 2 that you've been hearing about. And the more we look at it, the less complicated they become, but they are kind of interesting, and they are a little bit surprising, I think, to some employers. The first one is what people are calling the PCORI fee, and you've seen talk about this. This is the Patient-Centered Outcome Research Institute fee. It is the fee that starts, and it is going to be payable, and it probably for many employers it'll be payable starting in 2014 because their plan years ended in 2013. Now, before I tell you all the details, I am going to tell you this. AHP is a multiple employer welfare arrangement. It is a trust, and because we are a MEWA, it is the trust that is going to be paying this tax as opposed to individual employers. So this tax is out there if you have a single employer self-funded plan and you've got your own plan. For those of you that are guests, this tax may apply to you. If you were buying it from an insurance company, the insurance company is going to build this fee into their premium charges and they're going to pay it for you. In AHP, although it is an employer-paid tax, it is going to be paid by the trust. So what is it? Well, it's this amount of money that they designated to be paid to this center. It's a patient-centered institute that is really intended to look at success of patient treatment. My personal opinion is it's kind of the beginning of the rationing body because they're going to decide what procedures work, which ones are effective, and that is what's going to become the medical standard as to what should or shouldn't be done. How much is it? First year, it's $1 per belly button. Year 2, it's $2 per belly button. And this tax is ongoing. I believe it might expire at the end of 2018 or I think it's supposed to go away at 2018.
I wouldn't bet on
it. I wouldn't bet on it either. I don't think it'll ever go away. When is it due? It's due for any plan year that ended on or after October 2013, which means that calendar year plans generally going to have to pay the tax. It is due by the end of the 6 months, and most employers that had their regular plans will be paying this tax in 2014. The interesting thing is, how is it filed? Well, it's filed into this form that the Internal Revenue Service has out there called the Form 720, which is an excise self-reporting tax. The beauty of it is the form has very specific line items for all of these different excise taxes, but it does not have a line item for the PCORI fee that's going to go in it. It is expected that the IRS will actually reissue the Form 720, and then they're going to have to hurry up and get it done because these returns are going to be filed by June 30 by employers that are going to be required to pay it. But as it stands right now, there is no really good form. The 720 is a quarterly form. This tax is due on an annual basis. And if you try to find another line on that form, it doesn't exist. So fortunately for AHP members, this is not a fee that you will be filing a return on or paying a tax on. It will be done at the trust level so that you don't have to worry about it.
It'll be passed on through premium.
It will be passed on. It's in addition to your cost, and so it'll be passed on in your premiums in your cost sharing, but it is not something that you actually have to file your independent returns on, which is a good thing for you. The second fee is the reinsurance fee, which is starting to kick in next year. And this one is, I think you've seen the write-up on it as well. This is the one that is intended to be used to offset the adverse selection aspects of the exchange. And the fee is set by statute, if you can believe it. It is going to be $5.25 per month per belly button, which is about $83 per year per belly button. And it is an increased cost to every plan. The reinsurance fee is due it starts in 2014, so it'll be paid in 2015. It is the strangest bifurcated way of filing. I'll describe this to you for a minute. Who must pay? It's the plan. In this case, the reinsurance fee applies to the plan, as opposed to the PCORI fee that applies to the employer. The reinsurance fee applies to the plan. And again, AHP members, AHP, that's the trust, will pay the fee at the trust level. The cost is a cost that has to be passed on because it will be an actual amount due to the IRS, or actually HHS, but it is paid at the trust level as well. How is it filed? Well, the interesting thing about this is the way that it's supposed to work, and this makes no sense, is that the trust will report to HHS how many belly buttons it has by the end of September, after September 30th of 2014, and then when HHS gets the statement that tells them how many belly buttons they have, they will then send a bill and take the number of belly buttons and multiply it by the number that they have assigned, with $5.25 per month per belly button, and then send a bill, and then the trust will then remit the payment. Questions have been asked as to why, if I already know what the number is and I know my belly buttons, why don't I just send you a check? Let's eliminate half of this billing process. But HHS indicated at the seminar we were in Washington, D.C. 2 weeks ago that The reason they have to do that is because that's the only way that they can set up a bill so that they can collect it. Makes no sense. Both these fees will be paid by the trust, and that is an advantage. But the reality is both these fees increase the cost of health care for you.
And they do apply to any insurance vehicle out there, not just AHP.
Yes, these fees apply to everybody, whether you're self-funded or whether you're a fully insured product. Those fees apply. They will be passed on to the consumer through the insurance premiums or through the cost that AHP has to charge in order to provide benefits. They apply to everybody. The reinsurance fees, interestingly enough, in year one, which is 2014, by statute, they defined it that the need for this reinsurance for the exchanges, because this money will be redistributed to the exchanges, it will be redistributed to the insurance companies that provide insurance on the exchanges to help them meet the adverse selection cost within the exchange. The amount is set at $12 billion in 2014. It drops to $8 billion in 2015, and then it drops, I believe, to $6 billion in 2016, and then it supposedly completely goes away. Both these things are kind of interesting from a statutory point of view, because normally when you have fees of this sort, from a rational point of view, people really don't know what the adverse selection is and what the cost is going to be on the exchanges. So it's very difficult to understand how anybody could come up with a $12 billion estimate and say this is the number that's going to apply. But what has happened, because of the way the law was designed and the way that it was passed, is the drafters did not want to have to go back to Congress to get permission on any amount or any aspect of it. And so the dollar cost amounts were built into the statute directly to make the collections of those amounts, so they don't have to go back to Congress and say the reality is in year one it wasn't $12 billion, it was $30 billion. They don't have a way to change it unless they go back to Congress. And if any of you are watching TV lately, you'll know that Congress is not a place where many things get accomplished. Things get discussed and they get analyzed, but they don't get done. The other tax that's out there that does not apply to AHP is the tax that is called the health insurance tax, and that is on insurance companies. And these, again, these dollar amounts that you're seeing on the screen are built into the statute. They're not estimated based on reality and what adverse selection is going to be or how it's going to work. They're actually built into the statute. So for 2014, by law, they have to collect $8 billion from the insurance companies. AHP is a self-funded trust. It is not subject to this tax. Insurance companies will be subject to this tax. The amount you can see on the screen goes up to 11.13, 13.9, 14.3. If I were a betting person, I would tell you that those numbers are not very close to reality. However, because of the way they drafted it, they have to go back to Congress to raise those amounts and change the law and get more. The way that this is going to be applied is all of the insurance companies are going to be reporting to HHS, telling them how much they wrote in premiums every year. And then HHS is going to go into its little black box and do a calculation and decide how much is going to go back to each of those carriers. Interestingly enough, this is intended to be applied on a state-by-state level. But when they're looking at this, HHS really is not set up to act on a 50-state basis, and they have eliminated the states out of this component, so they want to do it all at the federal level, and they're trying to do it all on a mass level and apply it all on a national basis, proportionate to the national the premiums collected based on national cost of premiums sold. And in doing that, they actually have taken on, which is really unusual because the National Association of Insurance Commissioners has pretty much been a proponent of Obamacare, and they have favored Obamacare in a lot of ways, but they have finally set up and said, wait a minute, this doesn't make sense. You need to do it on a state-by-state basis. So we're seeing some rebellion, if you would, starting to hit. But that's a big chunk of money. I don't think that the amounts will be sufficient, but I don't think they're going to get to change them either. Let me move on to the next one. What will happen to the AHP benefits in 2014? There are a couple of things that I want to point out to you. Number one is Obamacare requires that the maximum wait period can't exceed 90 days. As a consequence, the maximum waiting period on AHP is going to be reduced to 60 days, and we're doing it starting with an effective date of July 1, 2014. The 60 days is to ensure that you have a 60-day waiting period and the rest of the days are used up to ensure that you actually get them on the plan. So if someone is hired in the middle of the month, all of our coverage begins on the first day of the month. If we had a 90-day wait period and they're hired mid-May and they waited June, July, mid-August, when you got them on September 1, you pass the 90 days, and therefore the 60 days is what we're going to be using operationally to ensure that you're always satisfying the 90-day windows. I want to point out that July 1, 2014 may look strange to people because everybody keeps talking about Obamacare kicking in January 1, 2014. The actual rule is most of the benefit changes kick in on the first plan year that begins on or after January 1, 2014. Advantage Health Plans Trust is a fiscal year trust. It reports to the federal government on a 5,500 on a fiscal year basis, and for purposes of the reporting requirements, the July 1, 2014 is the start. So when you see the dates on ours that say we're going to do this July 1, 2014, that's the reason that we're doing it that way. From a practical point of view, nothing that I'm going to show you in here is going to decrease costs. Earlier enrollment means increased cost. Preventive services and the other ones that I'm going to talk about means increased cost. So from a practical point of view, the trustees have decided to ensure that to minimize the cost to the trust, we're applying it not early, but on the date that it has to be applied. And that's where the July 1, 2014 kicks in. The second thing that's going to change is AHP is going to now go to an open enrollment change. And what that means is where AHP has allowed employees to add coverage during the year, not because there's a special enrollment rule that gave rise to a special right to add coverage during the year, but simply because they didn't add it when it was first offered to them. They're planning on something coming up, so they're going to sign up for the plan now. And what we've had in the past is a 90-day wait. Once they sign up for it, there's a 90-day wait for them to get on, and then the coverage takes effect. Open enrollment is kind of what most people are doing in the industry, and people are liking it more and more. So AHP is going to switch to the open enrollment period. And what this does for you is that effective July 1, 2013, the plan will no longer allow the late enrollees to come in. And again, late enrollees does not mean those individuals that truly have a special qualifying event. So if you have someone who gets married, that's not a person who is necessarily a late enrollee. That's a person who has the right to change their coverage because they had single coverage, they're now married, they can add a spouse. Those people are not impacted. The special enrollment rules have not changed, will not change, they remain in place. It's only for the people that chose not to do it, don't have a special right to come on earlier. Those are the people that are going to now, when they want to come on after July 1 of 2013, they will not be able to sign up until the open enrollment period, which currently is designated to be between October 1 and December 15th, and then their coverage will become effective January 1, 2014. Okay? So if you have someone that thinks they want to add coverage and hasn't added coverage, if they really want to get on under the current provisions, they need to do it before July 1. Past the July 1 date, open enrollment will be in play, and they will have to wait until January 1, 2014. But I want to reemphasize, this does not alter in any way anyone that has a special enrollment right. This does not delay them until January if they have a special enrollment right. Those rights will continue to be enforced, they continue to be a part of the plan, and they will be in play. The preventive services are going to be expanded in the plan effective July 1, 2014. I personally am still trying to figure out exactly what all these things really are. There's been a lot, mostly with the contraceptive provisions, the ones that have generated the most concern. They're still talking about it, if you can believe this. The last kind of conversations that I've heard indicate that some of these things that plans have not been willing to offer, especially the Christian-based groups, may actually be offered over the counter. And if they do, they are no longer going to be offered as prescription drugs if they're over the counter. But those will be in full play, whatever it is that they are required to be, effective July 1. Minimum coverage benefits, the essential health benefits that Obamacare requires. You've seen the category. There's 10 categories: hospitalization, prescription drugs. There's some additional benefits that will apply to children, namely in dental and vision, that has to be offered to children that is not necessarily a part of the plan today. It will be added. Again, the essential health benefits really are defined on a state-by-state basis, and I don't have the policies that are the exchange policies yet, so I'm not sure exactly what it's going to be, but whatever it is that we have to have, we will have it in place. Affordable plans. When I talked about the provisions of the pay or play, there was the statement that indicated that the plan had to be affordable. And there's really, I've got 2 safe harbors listed there, but there's really 3. The statute is 9.5% of the adjusted household income, but employers are not going to be put in a position of having to require employees to provide household income. And so what they will be providing is 9.5% of taxable compensation. That's box 1 in the W-2. Not gross compensation, but taxable. It can also be based on a rate of percentage paid, if you want to annualize it in that manner, so that it's 9.5% of the rate, the rate paid for the year. And the last safe harbor that is up, it's not on there, but it is a safe harbor that is, it can't be more than 9.5% of the poverty level income, which in dollars and cents right now is about $88.43 per employee. And affordable, just so that you keep in mind, is going to be based on employee-only coverage. It does not matter what the family cost is. It is measured solely on the employee basis. Whatever we have to offer for minimum coverage, we will have a minimum coverage plan. My guess is it's going to be a 60-40 plan to meet the minimums, and it will be available to every bank that participates in AHP, so that you as a bank will have a plan that you can offer to every employee that will meet all of the minimums and will be at an affordable level to meet the minimums. And in doing so, you should be covered under the pay or play penalties, because you will have something that is affordable to offer to every employee, full-time employee, that's required to be offered the coverage.
And I think on our most of our analysis so far, every plan that AHP offers far exceeds
every plan we
minimum.
offer.
So we're going to be building a plan that is quite a bit a reduced benefit.
It will be a reduced benefit, probably with a 60-40 copay. And then the last few minutes I'm going to spend here on the effect of exchanges. And this is an area that's always, it's frustrating to me as a lawyer, because it's very difficult to put my hands on what this is. What is the exchange? Well, it's supposed to be this Amazon site that you go to buy healthcare coverage for. There are 33 states that have chosen not to set up their own. These are going to be federally operated exchanges. The federal government is having a very, very difficult time right now trying to identify how they're going to put these in play, because they did not anticipate this many states not setting up their own state-sponsored plans. How is it going to work? In theory, we should know by now, but we don't. We should have a better view of it probably by September. It is going to be a marketplace where there will be plans offered that individuals can go in and look at a comparison with a summary of benefits, so they can check and see what each plan has and how they are different, and they can then choose what they want. The enrollment on the exchanges, if they want to get subsidized, is a very lengthy application. It's an 18-page deal right now that requires a lot of verification. Part of it will provide that it must give consent, the individual has to consent to having the IRS release their tax return, so that the exchange monitors, whoever they might be, are able to identify whether they qualify for these subsidies or don't qualify. Who can participate? Really anybody can participate on it, but they're not going to get a subsidy unless they meet the need test, and that's going to be based on their household income, and there's a scale as to how the costing is going to be. In Oklahoma, Attorney General Pruitt still has a lawsuit pending. That was done in part when the original challenges to Obamacare were done, but it was really done as a standalone case, so it was not part of what was settled in July of last year. And Oklahoma, he has challenged the applicability of these pay or play penalties to the state employers, to the extent that it's not going to be in a state-sponsored exchange, but in a federally facilitated exchange. The IRS says state-sponsored and federally facilitated really mean the same thing. The statutory provisions don't lend credence to that, and if he is successful, it would mean that the pay or play penalties in Oklahoma would apply to no one. That one's still to become. I think the biggest question on the exchanges is it really going to be less expensive? Is it really going to be affordable? Everything I have seen says no. Everything I'm hearing says no. There's a little graph there that's posted on there. It came, as you see the copyright on it, it's from the Independent Bankers independent insurance agents of Texas that came out in a seminar they did recently, and they analyzed the impact of the H rating on the cost of healthcare. And the younger the population, you see that they're predicting 29%. Now, the majority of those 21 to 29 are really going to be on the employer plans because of the age 26 requirement. And the whole purpose of this thing, which is really what I get real antsy and scared about, is that the costing of that is premised that the exchange is going to attract these healthy bodies to the exchange that are going to be paying more, as the graph indicates. And by paying more, they're shifting some of the costs, not just from the healthy ones, but to the older group of Americans, which is the big baby boomer generation, which is aging and is becoming more and more costly from a health point of view. If that group of healthy people chooses not to be in there because they'd rather pay the mandate, which is a nominal fee of $95 per year for next year, the money that is intended to come into the exchange for that is not going to be there, and the whole concept of adverse selection is going to be even more expanded because of the lack of the healthy paying, quote, their fair share to participate. No pun intended. I don't know where we are on the exchanges as the end all, because we still don't have what we know. I guarantee you that as soon as we have information on what the federally sponsored exchange in Oklahoma looks like, it will be passed on to you so that you're aware of it. I don't think that it's going to be a viable place for employers to go to, because I think the cost of healthcare there is going to be more expensive. That same report that generated that graph had a comment that I was shocked by when I went through the report, and it said, consider self-funding. And so I'm looking at it going, the independent insurance agents are telling you employers to consider self-funding. That's what, at AHP we've been talking about for a long time. And I think the self-funding arena is going to maintain and continue to grow and probably grow faster than it has in the past. And I see that I'm getting real close to, or just over the 1 hour. So let me just go to the last slide and tell you what I think you can do. Number one, you need to look at your employee base and determine whether or not you're going to be an employer that is going to be subject to the pay or play taxes. And by that, look at who your actual full-time employees are, figure out who is not a full-time employee, and determine whether you're going to keep them as part-time people and not allow them to get to the 30-hour average, or move them to the other classification. I think everybody evaluates the cost of paying. I think the cost is probably not as simple as looking at a $2,000 or $3,000. But on the $2,000, let me just give you this advice. When you're looking at paying $2,000, that is a non-deductible tax penalty, the cost is a lot higher. When you're looking at paying instead of being covered under a group health plan and telling your employees to go in the marketplace and buy their own, I think most employers are going to face either a disadvantage in terms of competitiveness with other employers, or they're going to have to pay their employees more to enable the employees to go out and purchase their own insurance. And when you give them more money, then you got to think that they're going to be buying with after-tax dollars, so you have to gross up what you're giving them so that they can go on a competitive basis. Probably not the most efficient thing. Worst case scenario, you have one person that falls through the cracks, doesn't get it the way they're supposed to, and you're subject to the $3,000 prorated for the number of months. That's probably a better cost analysis to work with than not offering any coverage at all. So just kind of keep that in the back of your head. And finally, encourage people to really become better consumers of healthcare. The AHP has had a big push towards transparency in using the Healthcare Blue Book and using the Advantage Premier providers. And it is a real means of encouraging employers and employees to watch the cost of healthcare. If we're going to contain the cost that AHP members provide, it has to be done because everybody is playing along the same way and under the same set of rules. And that is, we all own it, we all participate in it. If I save money for the trust, it saves money for all of us. And that's where the transparency is really important. Self-funded plans are here to stay. There are employers really working hard at trying to switch into self-funded plans that haven't been self-funded. They're looking at it because they have the ability to control costs in a much better way than they do in a fully insured product. And that, I think, is where AHP has done a very decent job in terms of making sure that we can contain the cost so that you're not in this 30%, 35% projected cost increase going forward.
And also, growth of self-funding that we're seeing out there is also not only in addition to what Maria just said, but in addition to what she said, it also allows the employers to maintain autonomy and be able to at least in a much better way control the benefits that are offered. And employers are starting to look at their benefit plans, especially after the Affordable Care Act comes into full swing, as a way of attracting and keeping the best talent out there. The exchanges are going to be homogenized. They are going to be kind of a one-size-fits-all. And the larger employers that are self-insured right now are seeing their self-funded plans as a strategic advantage, not just from a plan design standpoint and the business competitiveness, but also as a cost containment measure. Some of the taxes that do not apply to self-funded plans are a big deal. Also, just the ability to, like through the premier providers and the transparency movement that we've been encouraging, gives the ability for that self-funded employer to save the dollars. The dollars that are going out the door are theirs, and those employers and those employees are starting to recognize that. We had a trustees meeting just Friday, just a quarterly trustees meeting, and one of the trustees actually kind of coined the phrase that Advantage Health Plans is starting to look like a nice little country club that we can all belong to. I used to call it an island, but they didn't like island, and like deserted island metaphor, but the idea of more of an exclusive club for small employers, it really is kind of a haven for those employers. So with that, I think we're going to wrap up. And as Maria always reminds us, just because Maria said so, there's her obligatory disclaimer that these are in a general questions and comments were made in general manner. And if you have any fact-specific questions, you do need to either consult your own legal advice, or you can call us directly, and we'll try to help you on an individual basis. We're going to go ahead and open up to questions. See if I can do this without disconnecting or blowing something up. All right, in your GoToWebinar control panel, I think we're looking at under chat and questions. I think the question area actually works a little bit better for us. So we'll take some time here to take some questions if anybody has any. You all may need CPR or something to come off the floor after this meeting, but if you're still there and still in the mood to ask questions. All right, looks like we have one right now. Looks like this question is Kempton. It would actually be is Advantage Health Plans changing full-time from to 30 from 32 hours as far as the eligibility?
Yes, and that change will probably be effective July 1 of 2014, so that we give any employer that has the 31-hour person sitting out there the ability to make them have coverage available to them.
Right, so that'll be a July of 14. And also, I made a note. I think we had an error on our slide. It will be corrected when it's made available on the website, but on the slide that is titled Changes in Benefits, the AHP open enrollment change, where we talked about no more late enrollees beginning July of this year. We actually had on there July 1 of 2014 was on the slide. It should be July 1 of 2013. So the open enrollment, the new open enrollment period does go into effect at the end of this year.
Yes.
And so we won't be accepting what the plan document refers to as late enrollees, somebody that did not have a special enrollment period. We would not accept those after July of this year. Okay, lots more questions here. Let's see. All right. What is included? Can you read that? What is included in the numerator of the 9.5% calculation? Premium, deductible, copay, employer contribution?
The cost that is charged to the employee is the component that you're looking at. It is only their share of the cost, not the entire cost. Premiums, all the rest of it is not considered. It's just whether the amount that the employee is required to pay as a percentage of their taxable compensation or as a percentage of the imputed number is above 9.5%. And that's employee-only coverage. You don't have to take into account the whole parameters. And just as a side note, just to make sure that people understand, one of the things that I mentioned is that we will have a low base plan that is going to be the minimum that we have to get by with to make sure that it is available to everybody. So when you're measuring whether they're doing the 9.5%, if you offer the low paid plan that is going to meet the minimum criteria, and you have a second alternative, but the second alternative is a more generous plan and therefore more costly, the measurement is going to be based on the minimum that you have to offer. So you're going to offer them both options. The minimum that Obamacare says we got to have, and you can also take this option over here. The 9.5% will be measured from the lowest benefit plan that you will make available to them.
That meets the threshold.
Not necessarily the plan that they choose to take. So if they choose a more generous plan and it happens to cost 12% of their compensation, but they had the option of using the lower plan that cost 8% of their compensation, you will have the ability to demonstrate that you have complied with the rule. That's a good question.
Yeah, it is. And we do anticipate that if you are a bank that is within the pay or play threshold, so the over the 50 full-time or full-time equivalents, I can't imagine a scenario in which you will not be offering multiple plans. And of those multiple plans that you're going to be offering under AHP, one of them will be the new minimum plan that it does not currently exist under Advantage, and it will be a lower cost, lower benefit plan than we've ever felt like was appropriate in the marketplace. It will be a bare bones plan, but is going to be there in place for employers that need to have something that is going to meet the minimum requirement as far as a benefit level. And then also will be the one that we'll envision that will be the benchmark for you to be able to meet your affordability offering thresholds.
And keep in mind, if I might interject, that the employee doesn't have to take it. Your responsibility as an employer is that you offer the coverage that is affordable. So as long as you can document that the coverage, the minimum base coverage that you offer them is affordable within the 9.5 affordability parameters, then you've met your obligations, even if they choose not to take it.
That's a great point. Besides our healthcare providers, can we call you for help, or is there a number to get help? Absolutely. You can call the same 1-800-521-1711. If the question is regards to ACA compliance and you are an Advantage Health Plans member, we'll definitely get you routed to Maria. She is just one person, and so you may have to leave a message and she would make a call back if she's helping somebody else. But you just call the 1-800 number that you contact for customer service or any other issues, and we'll get you to Maria. We're talking when talking about consumerism, is AHP looking at options for better preventative health to reduce the overall cost? Advantage Health Plans is a non-grandfathered plan. We never sought or were able to maintain grandfather status, and we knew that going in. And so really all of the ACA mandated preventative coverages are paid at 100%. With no copays, no deductibles, or they are essentially free to the employers or to the employees. We are always looking at any ways to enhance the overall healthfulness of the employee population. And Advantage also does offer, which I think may be part of what we're talking about here, does offer a optional, very comprehensive wellness program with built-in rewards, lots of carrots out there to incent utilization of healthy programs, whether it be biometrics to determine whether people are actually moving the needle in the right direction. All sorts of wellness initiatives are available under that program. You can definitely contact your rep that your Advantage Health Plans rep to learn more about that. It is something that, at least at this point, it is not free to AHP members, so each individual bank would have to make a purchase of that. But we do have several banks that do utilize that, which would be an enhancement beyond the ACA mandated wellness benefits. How much did you say the PCORI tax is?
In year one, the PCORI tax is $1 per belly button, and in year two, the PCORI tax is $2 per belly button.
And again, that would be calculated by Advantage on your behalf and would be submitted to, I believe PCORI is HHS? Would be submitted to HHS on your behalf. And like anything else, just like claims or any other fixed costs that Advantage Health Plans has to pay, the actuaries will just be building that in. But at least from a compliance standpoint and an administrative standpoint, the member banks do not have to worry about that other than the cost, unfortunately. Does the 60-day waiting period also begin this year rather than 2014?
No, that will be effective July 1, 2014.
That's when the pay or play will kick in for Advantage as well.
That's right.
All these effective dates and all these tests for determining, when we ask the banks about full-time employees for the purposes of this test or this other analysis for the purposes of this test. If you're confused, you are in good company.
Yes.
We were at a seminar, a large seminar where there were several million employees were represented either through their third-party administrator or through a stop-loss carrier. It was in Washington, D.C. 2 weeks ago. And again, let's just put it this way. There was actually a slide. I wish we had it. It was funny, but it said, if you are not confused about what you're hearing, you're in trouble because you obviously don't understand what we're talking about here, which is sad but true.
One other commentary on that 60-day wait. In Advantage Health Plans Trust, every employer has the ability to define their waiting period. So there are plans out there that have a 30-day wait already. There are plans that don't have a 30-day wait. They're the
90.
First day. And there are a few that have 90. The ones that will be impacted are only those that have the 90-day wait period. That will have to shift down to the 60-day wait period. And prior to the date that kicks in, you will get notices out there that remind you that if you have a 90-day wait, you need to change because July 1 is going to trigger early enrollment for some people that would not otherwise have met the criteria. But not everyone's currently under that long extended period. Some of the banks have a much shorter window already.
Can we keep a copy of this PowerPoint? Absolutely. This will be it will be out there on the Advantage Health Plans website under resources. Hopefully that'll be done within a couple, 3 days. You'll have that. If you like just a copy of just the PowerPoint, you can send an email to, probably the best would be, the PowerPoint's already on the website. Okay, thank you. Actually, this PowerPoint is already on AdvantageHealthPlans.com under the resources tab. And so the 2 or 3 day wait will be actually for the audio video commentary. Lots of questions.
Read it? Huh? You want to just read it out loud?
Yeah, so this plan only affects our part-time people that should be considered full-time.
If the question, I think the question is, the people that are already included in coverage don't impact you. That's true. The plan may affect, you may be required to offer coverage to people that you didn't classify as full-time because they switch into the full-time. But the plan does not require to be offered to part-time people. The clarification, I'm not sure where the question was coming from, but the clarification that may need to be made is you count part-time people as full-time equivalents for purposes of figuring out if you are at a 50 or more threshold subject to the pay or pay penalties. But once you're talking about coverage, coverage only has to be offered to individuals who are full-time employees, and that is 30 hours or more. I'm not sure if that answers your question. If it doesn't, tag another one on.
And again, we have been trying to keep this in the context of advantage health plans, but as far as pay or play or really, there's nothing that we have described here this morning other than, I believe, the health insurance tax or the HIT tax that does not also apply if you were not with advantage health plans. If you are with Aetna or with Blue Cross and Blue Shield, these things apply the same. When will you be sending out details of the affordable plan? Probably it's going to be sometime early in 2014. Yeah. We need to get through the January 1 of 2014 renewal. Then we'll have that plan designed. Right now, there is not a lot of good guidance as far as even designing that plan. You do have a calculator that is available out there at the federal level, but every plan that you run, it's not a very detailed calculator. It's an extremely dumbed down calculator, and we're hoping for additional guidance that will. We are trying to have a plan that, since all of the AHP plans we're instead of meeting the 60% actuarial value threshold, most plans under Advantage are going to be in the 80s and 90% actuarial value. So it's going to take a little work, and we want to make sure that we're doing the right thing as far as designing a plan that still offers quality coverage to the employees. But we want, from a costing standpoint, we want to get that value down into the low 60s. And that's going to take a whole new plan design.
And one of the things that makes it difficult to be able to do it at this point is that the minimum essential listing of what is included, and what will be included, is really going to be geared off of what the Oklahoma exchange plans look like. Every state has the flexibility to have its own, and the feds have basically denominated specific plans as being minimum plans that will meet the criteria. But as of right now, none of those plans are available because they're still going through the process of going to the insurance commissioners and getting the plans approved, because they actually get their plans through the department and have to have the rates and the content of them approved in order for them to be able to sell them as an insured product in any given state. So we haven't yet seen what that product looks like in Texas or what it looks like in Oklahoma, and we're going to wait to see what those things are before we define what the minimum base plan is going to be. But we will have a plan that will meet the criteria.
That's right. Okay, next question. In regards to seasonal/temporary employees, can these be calculated on an annualized basis, or does it need to be per month hours worked?
The IRS is very adamant that it's on an monthly basis. They really don't allow you to look at it on an annualized basis. They allow you to look at it on a monthly basis.
And that was a topic of discussion.
That was a big topic
DC.
of discussion, yeah. One of the things that is not yet out, and I think we will be getting some guidance on, is exactly what seasonal means. Like I told you, the Department of Labor seasonal standards really are for the agricultural workers and for like the people that do the Christmas deal. Adjunct professors are kind of weird, but it's not quite defined, and I think there will be a few refinements made with regard to who is really considered seasonal before we can really put our hands around as to what you've got to include. It is an area that has raised a lot of concern. I think there's a lot of commentary out in Washington about it, but I don't have anything back yet as to what that is.
If a bank adopts the CHEAP plan, that's probably a pretty apropos title for it, the CHEAP plan, does this replace the other plans that the bank offers, since we can only offer a few plans at a time? Actually, we do allow up to 3 plans within an employer group to be offered. So, it would, that's something that if it becomes a problem for the banks, that's something that I know the trustees would look at, expanding the offering beyond just the 3. But I think it would, a bank doesn't have to offer the CHEAP plan, But I think in most situations, the low plan, which, maybe today is, a $1,500 or a $2,000 deductible is your low plan or your cheap plan. This new plan would probably unseat that and would be your new low plan or lowest cost offering out there. But again, we'll look at that, and we're out, we're in the banks and taking feedback all the time. So if 3 plans isn't enough because of this new cheap plan having to be offered, we could look at expanding that. Okay, the slide, we're referring to the presentation, the slide states that part-time employees should be consistently less than 25 hours a week. Is that your suggestion, or is that part of the regulation? That's a good question.
That's probably my suggestion, because anything less than 30 is part-time. I think where people can run into issues is when they have a 28-hour-a-week person who, for one reason or another, has to work a couple of hours overtime, a couple of weeks in a row. You can actually transition them into being an average of 30 or more inadvertently. In what I'm seeing in industry-wise, most people that are doing part-time, they're either like at 20 hours or 25, that they consistently classify them as part-time when they're at that level. I have not talked to many that say that 29 hours is part-time. Usually the 24, 25, but if you can work with 28, you can do 28. It just doesn't give you a whole lot of wiggle room in the event that for one reason or another that person has to work a few extra hours. When you average them in, you suddenly can be in the 30-hour average.
I think our recommendation on that was just simply if you wanted an easier cut and dry method, that would be kind of that real safe harbor, if you will, without having to really micromanage that. But absolutely, yeah. you can run it up closer to the line if that is what you need to do in your particular business. As a self-funded plan, does age and other traditional underwriting criteria still apply when setting premium and contribution amounts?
I think what you're referring to is really the way that they are required to do it on the exchanges. At AHP, the pool that we work with is classified generally as a large employer because it has more than even 100. The question that you're asking about on that consideration usually applies in the small employer market. It isn't a consideration that is going to apply at AHP in terms of specific underwriting by groups, by age. It's really based on the big group as a whole.
Sure.
At AHP.
I think she may also be talking a little bit about the actual risk bucketing as far as a bank being moving within the rate structure of advanced health plans based on demographics and morbidity. That Milliman does for us. I believe that's going to continue. We have to have, and that was something that we got a lot of input from the banks and from the trustees, that there does need to be some type of a predictor, more of an objective predictor of future claims for setting rates. And now I think we're in our 6th year of that. It's been probably the most reliable predictor of future claims as possible, as far as demographics and morbidity being taken into consideration. At the end of the day, the trust has to have enough dollars to pay the claims, pay the overhead. And if you all will remember, prior to our risk categories, when everybody paid one rate, obviously that's the easiest. However, the groups that have fewer claims, they didn't like it, and then the groups that had a lot of claims really liked it. So that's kind of the other extreme. If you're going to move away from that, you do have to have some type of a tool to help predict current and future risk within the trust. Will we receive the rates for 2014 in time for open enrollment? That is a great question, because it's something that we are working on right now. It was actually discussed in the trustees meeting on Friday. Because of the new open enrollment change, that creates a time squeeze, not just for the member banks, but also for the Kempton group as far as being able to make sure we get the changes in and get everybody enrolled. But if we're not able to get the information back out to the banks before, say, middle of November, it puts a crunch there. Those are things that we're looking at right now. We've actually are talking with Milliman about the idea of potentially pushing back the time where they're not giving us 10 months they're not making rate renewal recommendations based on 10 months of data, but maybe making those recommendations based on a smaller time slice. We do know that will affect the fidelity of or the accuracy of the actuarial recommendations. And so that's going to be something that, how much is it going to affect it? I don't know. We're going to have to rely on the actuary to tell us. It is something that your bankers, your banker trustees are aware of. They're sitting in exactly your same shoes. And so just stay tuned on that. We are aware of it, and we're trying to come up with some creative ideas on how we can make it easier on everybody. Can I have that 1-800 number again? Or is this for Advantage Health Plans care coverage only? No, let me give you that 800 number. It's 1-800-521-1711. And that number is the general number, but we can get you wherever you need to be, whether it be sales and marketing, it be customer service, or it be Maria's office. Okay, will the high deductible plans satisfy the new low cost plan requirements? We have not tested every one of them, but I would doubt seriously if any plan that AHP offers does not exceed the minimum. So, just got a little note from our producer here. I would be very surprised if any plan that's offered right now does not exceed the minimums. Usually if what we're seeing is if the plan is more rich than a 60-40 plan, generally speaking, the results coming back from the calculator is that minimum value, actuarial value, is coming back in excess of the 60. Some of the data that was done out there in DC, they were playing with the calculator in the seminar. A normal plan, which would be an 80-20 with a $1,500 deductible plan, it came back at what, like 85% of the minimum value. So
and we have to be at 60.
Yeah, that's the minimum, the lower threshold.
I think that the one thing that I know we will be doing when we get closer to having to implement all of this stuff is when we have all of the different plans, you will be notified of the plans that meet the criteria because it is deemed to be minimum coverage, and the ones that the costing, obviously you've got to do at your own end because it's based on compensation. But when we put out the plan information together, you will have information that tells you whether any of them don't meet the criteria so that people are aware of it. And you got to keep in mind that the thing about this penalty stuff and what we have is your obligation as an employer is to offer a plan that meets all of that criteria that the statute imposes, the affordability, minimum coverage, and all that. But an employee can choose an alternative that doesn't meet that criteria if it is an option. So long as you're offering both options and they have an option to take the one that meets the criteria, then as an employer, you're going to be okay. They can still choose to have something that is different that doesn't meet it, but they have the option to get the one that does.
That's a good point. We will be offering the plans out there that pretty much every plan that we offer will meet the criteria. But you may, at your particular bank, you may want to just leave the plan offerings, especially if you're under 50. But even if you're over 50, you may choose to leave the plans that you offer completely alone. If you're happy with the cost and the cost sharing is no more than 9.5%. then you could be good. We are going to have that in our quiver. However, that lower cost plan, because for some employers that are saying, well, I'm going to have to offer this and to the lower cost, and I'm going to have to provide a level of contribution for on my employees' behalf. We just felt like it was our duty, as did the banker trustees, to let's have kind of our own minimal cost safe harbor plan out there. But you're right. If the other plans within AHP do meet the minimum, you may not even offer the new low cheap plan.
The goal is going to be just to make sure that you have a sufficient range of offerings that assist you in making sure that you comply with what you've got to offer. But it doesn't have to be something that is the mainstream if you're willing to do a lower cost sharing with some of the other plans too.
Considering AHP is in need of more affordable cost plans, are we considering removing the HDHP options? That is not something that is under consideration now. After 2014 rolls around and we see if utilization of some plan designs becomes very, very low, we may consolidate or remove plans that are being offered. But right now we are looking at just having a net increase of one plan out there. It's not that we're going to add one and take two away. We do have several banks that are on one of the HDHP plans. Okay, we are way over. I think we're about with the end of the questions out there. I hope that we addressed most, if not all, of your questions or comments. And if anybody has any additional questions, we're definitely going to be here today to answer those or in the days and weeks ahead. So thank you all so much for your interest. Like I said, the interest was kind of over the top for this important topic, and really appreciate everybody's investment of time and their continued support of their health plan, Advantage Health Plan. So with that, we'll wrap up. Thanks, everyone. Have a great day.